Swadikap. Good afternoon once again. Today is Wednesday, the 30th of June, 2021, the last day of the month of June, and this is the English language summary of the daily press briefing here at the Center for COVID Situation Administration, or CCSA, as always. So thank you to Dr. Tui Sin for the briefing just now. He ended with a very important note, an important observation, that obviously right now we are all facing emotional fatigue as well as general exhaustion in society, not only in Thailand, but around the world. Now, that's something that we have to continue to join hands and continue to fight off COVID together. Our efforts will pay off, I'm sure. He also mentioned about the various clusters in Bangkok, which currently there are around 100 plus clusters, new clusters now that are being monitored within the Bangkok area. Start off first with the vaccination progress update on the national vaccination program since we started. So as of yesterday, the 29th of June 2021, Thailand has administered already over 9.6 million doses of vaccines in total. In detail, exactly 9,672,706 doses. And out of this number, around 6.9 million received their first doses, and 2.7 million are people who have received their second doses. So this means that the inoculation drive has now covered 7.94% of those residing in Bangkok and its peripheral provinces, while the average for the other 71 provinces is at around 2.17%. The national inoculation coverage now stands at 3.84% for the entire population. And of course, we have one more day in June, which is today, still to be recorded, and hopefully we'll reach our target of 10 million doses by the end of the month, according to the target. So let's move on now to today's figures. We have new confirmed cases at 4,782. The total number of the cumulative number of cases so far is 259,301, as you see on screen. We have active cases still being treated currently at almost 50,000. Exactly, that would be 49,799. And out of this number, we have 1,911, a little bit lower than 2,000, which is in critical condition. While of this number, 556 are patients on ventilators. We have recoveries every day. The recovery rate for these past days have been kind of lower than the new confirmed cases that we have. So we recorded yesterday 2,415 new recoveries as compared to the new confirmed case being over 47,000. Unfortunately, we have new fatalities at 53, making the cumulative at 2,023, as you see on the screen. Now, on the various provinces which have the top number of cases reported, you can see that on screen. As in the past weeks, we have Bangkok with the highest number of new cases at 1,826. And for the other provinces, you can look at that on screen, mostly a combination of provinces in the central region as well as provinces in the southern region of Thailand. As you see on screen, Songkhla, Yala, and Pattani provinces are in southern Thailand. And just some observations that the trend continues to be in Bangkok and peripheral provinces. The factories, construction sites, and construction workers' camps are continued to be actively monitored as they contribute to the increasing number of infections. And the active case findings have been ongoing at these venues, including other public health measures, such as the closure of these construction sites, which we talked about yesterday, particularly the larger construction sites with like 100 or 200 plus construction workers. Those are being monitored and closed off. Another important contributor is the infection among family members, especially when having meals together. Now, one information which is about foreign affairs, which was not mentioned in the Thai language edition, but I'll mention it here because it concerns foreign affairs, is on the exchange of notes between Thailand and Japan on the provision of AstraZeneca vaccines to Thailand. So yesterday, His Excellency Don Paramatwinai, the Deputy Prime Minister and Minister of Foreign Affairs, on behalf of the Royal Thai Government, and His Excellency Mr. Nishida Kazuya, the Ambassador of Japan to Thailand, on behalf of the Japanese government, signed an exchange of notes at the Ministry of Foreign Affairs. The officials from the Health Ministry, Foreign Ministry, as well as the Embassy were in attendance. The government of Japan would be providing, through this exchange of notes, 1,050,000 doses of AstraZeneca vaccines to the Royal Thai government to help alleviate the situation. And this stands, of course, as a testament to the close and cordial strategic partnership between the two countries. And to this end, the relevant Thai and Japanese agencies are closely coordinating to ensure the timely arrival of this lot of vaccines, which is scheduled to arrive in Thailand on the 9th of July in around 10 days' time. The handover ceremony will also be held when the vaccines arrive. So this is the exchange of notes that happened yesterday. Regarding the Phuket Sandbox scheme launch, which you have been, of course, learned about already. We talked about this yesterday already, and we're prepared for the opening tomorrow. I'll speak a bit about that. So as you may know, tomorrow, the launch of the official scheme of the Phuket Sandbox as part of our efforts to gradually revitalize the tourism industry. So as of tomorrow, the 1st of July, tourists and travelers from designated countries, around 63 specifically, and 3 other territories may come to Phuket for tourism and business purposes. And you have on screen the list of countries there. And pursuant to the directives of the government as announced in the Royal Gazette on the 29th of June, measures to enter Thailand for both Thais and non-Thai nationals are as follows. For pre-arrival requirements, travelers from countries or regions approved must have been in the said countries that we listed, must have been in the said countries for no less than 21 days before their travel date, except Thai nationals and foreign expats returning from overseas, and they're advised to avoid at-risk areas and crowded places in no less than 14 days before the travel date to Thailand. They must register their travel via the designated system, which is coethailand.mfa.go.th, and have the following documents: passport, the COE, medical certificate with the result of RT-PCR testing that there is no COVID detected in no more than 72 hours before the travel date. Copy of insurance policy in English covering healthcare and treatment expenses for the applicant for the whole duration of the visit to Thailand, to Phuket, with coverage clearly identified as no less than $100,000. A copy of the payment confirmation for no less than 14 nights stay, and RT-PCR tests approved in the SHA Plus hotels. In case that the length of the stay is less than 14 days, travelers must present a confirmed flight ticket out of Thailand and payment confirmation for accommodation and the RT-PCR tests at hotels that cover their intended duration of stay. Also, a certificate of vaccination against COVID with a vaccine approved by the Health Ministry or the World Health Organization no less than 14 days before the travel date. And travelers under 18 traveling with parents or guardians must have medical certificate with a lab result by an RT-PCR method indicating that there is no COVID detected 72 hours before travel date. And travelers must undergo exit screening before departure. So what I mentioned was the pre-arrival requirements. Now, it may seem like a long list, but of course, this is our pilot project. It's the first time that we are officially opening up a particular province for tourism and business purposes. So we have to be very careful, and I'm sure that all of the travelers coming to Thailand would understand this. And if all goes well, of course, we hope so, we continue with the Phuket scheme, and that will be extended to other provinces in due course. So that was a pre-arrival. Now for arrival procedures, entry, screening, and immigration and customs procedures, the travelers on direct flights, non-stop flights, and transfer flights to Phuket International Airport are subject to health screening and relevant immigration customs procedures at the port of entry as usual. They must download and install an application as well as set the application to active mode at all times for the whole duration of the stay in Thailand and proceed directly to the reserved hotel on approved airport transfer service. Undergo the COVID RT-PCR test at the traveler's own expense as per the requirements. In case the traveler is tested positive, he or she will be referred to specified healthcare facilities for treatment, with any expenses incurred to be covered by the health insurance of the traveler. If the test results come back as negative, the person can continue to travel in Phuket. And travelers with the intended length of stay less than 14 days must leave Phuket and Thailand immediately on an international flight to another country on or before their intended departure date. And travelers who have completed 14 nights in Phuket will be allowed to continue their journey to other Thai destinations, other provinces in Thailand outside of Phuket. And on the international and domestic departure, travelers are advised to follow and strictly comply with guidelines and measures announced by their respective area or country of destination when traveling from Phuket to other countries. Travelers looking to go on to other destinations in Thailand after the 14 days are required to show proof that they have completed the 14-night stay at their accommodation in Phuket, along with other required documents as per the guidelines and measures announced by respective destinations. And for the COE, Certificate of Entry, travelers must apply through the website to receive the COE no more than 13 days before the intended date of entry into Thailand. And of course, this is at the Thai embassies abroad before coming in. I think on screen there is a sample of these requirements for the COE from the Royal Thai Embassy in London, UK. And the same conditions and stipulations as the normal COEs apply. So the Ministry of Foreign Affairs has instructed already all the Royal Thai embassies and Royal Thai consulates around the world to review all COE applications since the beginning of this week. And as of 9 a.m. of this morning, there have been 4,909, so almost 5,000 COE applicants already as of 9 a.m. this morning. Information we received from the Thai embassies. So around almost 5,000 applicants are ready for the COE to come to Phuket, of which around 500 have already duly been approved by the Department of Disease Control after they had inspected the authenticity of the certificate of vaccination. Now, the Phuket Sandbox scheme is garnering a lot of attention, obviously, and in the intended areas and countries of travelers who want to come to Thailand. For example, in Sweden and in Qatar, just as some examples. So many Swedish nationals have made numerous inquiries about the scheme with the Royal Thai Embassy in Stockholm. The same goes to Qataris in Qatar, where the Royal Thai Embassy in Doha, Qatar, has received many questions about the scheme. In Qatar in particular, since Qatar Airways will be starting to offer direct flights from Doha to Phuket 4 times a week. And other airlines around the world have also expressed their interest in flying to Phuket in response to the opening of the Phuket Sandbox scheme, including Singapore Airlines, Etihad, Emirates, Oman Air, El Al, Israel Airlines, etc. And as usual, the Royal Thai embassies and consulates around the world will stand ready to answer any inquiries on the issuance of the COEs for the entry into the Phuket Sandbox. Now, I gave a bit of detailed information about the Phuket Sandbox. Perhaps I'll recap again tomorrow, because tomorrow is the first day, and perhaps we'll have more information and statistics of the actual passengers arriving in Phuket on the first day of the Phuket Sandbox. And this week, of course, the officials will be visiting Phuket. Well, we're making on-site visits to Phuket to ensure the success and efficiency of this pilot scheme. So just to conclude for today, I'd just like to remind you once again that the public health authorities have continued to urge the public to adopt strict work from home measures at the strictest level, avoid large gatherings, and refrain from dining together in large groups. As you know, restaurants in the dark red zone area, Bangkok and the other provinces, are prohibited from serving food, dine-in food, and you can only order to take out. But of course, what I meant was dining together privately as well. That's also very important, to avoid dining privately in large groups. And do remember to keep up with the various measures and all do our part in helping to flatten the COVID curve. In the past days and weeks, we have had 3,000, 4,000 per day, hoping that we will soon be able to flatten that, decrease that number with the vaccine rollout coming. Almost 10 million jabs already this month, in the month of June, as per the target. So it all depends on us, the cooperation of all of us in society. So thank you. With that, thank you very much for your attention. We'll be back with the English language summary of the daily press briefing tomorrow. สวัสดีครับ